Aloha. Thank you for joining me. I'm happy to have you here with us today. Um, so again, thank you so much for joining. Uh, so for those of you who aren't familiar with me, my name is Dr. Catherine Taketa-Wong. I'm a naturopathic physician and ND. And like medical doctors, NDs attend a four-year medical school, and we're trained as primary care physicians. I can order lab tests, write prescriptions, and do school physicals, the same as any other doctor. I'm also a licensed acupuncturist trained in Chinese medicine. The typical medical school offers 19.6 hours of nutrition, whereas naturopathic doctors receive 155 hours of nutrition. And we're trained in the power of nutrition to build health from the inside. In addition, I use vitamins, healing herbs, and other natural medicines to deal with the underlying causes of disease and treat the whole person. Doing things that way takes a lot more time than just prescribing pills. My office visits are a full hour, and that is one-on-one with me as a physician. As the talk progresses, if you have any health concerns that you would like to talk with me about, please call our office to schedule a no-charge phone consultation called the Personal Health Strategy Session. I believe it's important to talk with people before they go ahead and schedule an appointment so we both have a better idea of what needs to be achieved. Our number is 808-425-2987. You'll find all of our contact information here on our Facebook page. Today, we are going to be talking about hidden allergies and sensitivities and the problems that they can cause for many people without them even realizing that they actually could have hidden allergies or sensitivities. They can cause all kinds of problems. So, for example, are you or your loved ones having problems with fatigue, autoimmune diseases, joint pain, trouble sleeping, coughs and colds, or maybe just getting sick all the time, even bedwetting beyond a normal age, and anxiety can be related to food sensitivities or allergies. Children with autism and special needs who have many behavioral problems and meltdowns are frequently exhibiting reactions to food allergies or to sensitivities. And while you may not have the typical allergy symptoms or noticeable digestive symptoms, what could be happening is that your body has a low level of allergies and sensitivities. I have seen individuals with ADHD where their attention and focus actually improves after we take out food allergies and sensitivities from their diet, even in cases where they didn't have the typical allergy symptoms like itchy, watery eyes or nose, or hives or wheezing, those kinds of things. I have seen children with autism where their behaviors, for example, frequent meltdowns, or even their cognitive function or awareness improve after we take out food allergies or sensitivities. Many children with autism also are extremely picky eaters, and it's really difficult to get healthy foods into them. And interestingly enough, I've seen where food sensitivities create more inflammation in their body, and they actually start eating more foods and you start eating a wider variety of foods after we take out foods from their diet that are causing more inflammation in their body. So some of these things are things that people don't typically associate with allergies or with sensitivities. Many people don't even know what sensitivities are. Um, so a common one that I see are gluten and dairy. And we find that when we remove gluten and dairy from the diet of many children, for example, children with ADHD, their focus and attention improves. And as I mentioned earlier, I've definitely seen children with autism whose behavior as well as whose language and awareness has improved with removing particularly gluten and dairy are very common ones that are problematic foods. But I do want to be clear that it's not only gluten and dairy. There are children with autism and ADHD who may have other food sensitivities, or also people with a number of the other symptoms that I mentioned earlier, fatigue or headaches or joint pain that are unexplained and you can't figure out why, those could be related to food sensitivities. And that's where I find the testing to be very helpful. As I mentioned, these can mean individuals who don't have the common allergy symptoms, the itchy, red, watery eyes, the sneezing, the skin rashes. Um, and as I mentioned, with some patients, when we found allergies coming up on their test and we worked with upgrading their food choices, we found that their symptoms started to diminish right away. Now, what is the difference between allergies and sensitivities? Most people don't realize that there actually is a difference. With allergies, our immune system is attacking something that is not actually inherently harmful or disease causing normally. So, our immune system is supposed to attack things like bacteria or fungus or yeast or viruses that can make us sick. But with allergies, our immune system is attacking things like certain foods, for example, peanuts. The immune system thinks that peanuts are bad and starts attacking it. People can have allergies to pollen or dust, cheese, dog fur, and so on. There's nothing inherently wrong with these things, but for some reason, the immune system thinks that there is. An actual allergy is associated with the typical kinds of symptoms that we think about with allergies, like itchy, red, watery eyes, or sneezing, or skin rashes, or hives. Some people may have diarrhea or abdominal pain. Some people can have really bad allergies where it even affects their lungs and it causes wheezing or difficulty breathing, and it can lead to asthma. Very severe allergies can be life-threatening. The tongue or the throat may swell up to the point where a person can't breathe because the allergic response causes swelling in their throat, and that blocks the trachea, the tube that connects the nose and the lungs, and that can shut down breathing. When people have very severe allergic reactions, it can even affect the heart. And people who have severe allergies may carry EpiPens or injectable epinephrine in the case that they have an allergy attack. And this injectable epinephrine can be very helpful if it's a very severe reaction. In allergies, the body makes an antibody called IgE. With sensitivities, the body makes a different antibody called IgG. These are two separate antibodies. They're two completely different proteins. So, for example, a person may not have an allergy to eggs, so an allergy test would come up negative for eggs, but they may have a sensitivity to the eggs, which we find from a different test. Other sensitivities can stem from not having the proper enzymes to break down and digest a particular food. One that is fairly common is lactose intolerance, lactose being milk sugar. In this instance, if someone eats lactose, which is the milk sugar, they don't have the enzyme to break it down. The enzyme is called lactase. So if someone has a lactose intolerance, which is another way of saying a sensitivity, and they drink milk or eat ice cream or cheese, they may have stomach pain, they may feel bloated, they may have other digestive problems. We can do lab tests to find out. There are other foods that people may not have the proper digestive enzymes for, including fats or proteins. There are tests for those as well. Some people can take a supplement with the needed enzyme and be able to eat the food that was giving them the problems. Lactase is a common one, but other times you may just get much better results by avoiding the food altogether. As always, it really does depend on the individual. So we'll get back to how hidden allergies may be behind fatigue, digestive problems, headaches, and more in a moment. But before we go on, I wanted to pause to remind those who are just joining us that we offer a no-charge personal health strategy session. That's our phone consultation where you can talk with me personally about any health concerns you may have and about how to feel empowered about your health. To arrange one, just call our office and ask to be scheduled for your free consultation. I believe it's important to talk with people before they go ahead and schedule an appointment so we both have a better idea of about what needs to be achieved. Our number is 808-425-2987. You'll find all the contact information right here on our Facebook page. In fact, you can just click on the contact button. One very important thing to remember is if your doctor has already tested you for allergies and found no problems, or if your allergist has tested you and yet you are still having problems, you're still having symptoms that you can't figure out what's causing them, it may be food sensitivities, and that requires a different test. I've had many patients who had unexplainable symptoms and negative allergy tests who wind up having sensitivities. As you can imagine, they are very relieved to find some answers. And I found that, again, as we take those foods out of their diet and upgrade their food choices, they start feeling better. Unexplained headaches go away, or their joint pain gets better. Their mood or depression, anxiety, or children with autism or ADHD, their behaviors or their attention focus improves. There are natural ways to treat both allergies and sensitivities, always beginning with the proper testing. For example, one reason for many of the common allergy symptoms is that the body is making too much histamine. And that could be treated with an antihistamine. For example, a typical antihistamine is one called Benadryl, which is pretty well known. But that comes with side effects, including feeling tired all the time. But there is an herb that is also an antihistamine called nettles. There are other natural antihistamine compounds in foods like onions, apples, and garlic. There are some people who have trouble breaking down the histamines in foods because of genetic mutations. For these people, another natural approach to treating allergies is a low histamine diet. If you take out the foods that contain high amounts of histamine or cause your body to produce them, it can help your allergy symptoms to go down in these people. High histamine foods include things like alcohol, sauerkraut, vinegar, soy sauce, kefir, yogurt, kombucha, as well as aged meats like sausages, salami, and certain vegetables, including tomatoes and eggplant. Behind many allergies and sensitivities is an imbalance in the immune system, which can be the root cause. Research has found that the cells in our immune system communicate with the bacteria in our gut. People are pretty much aware that probiotics, or good bacteria, help our digestive system. Many are not yet aware that probiotics also will often help our immune system. If the gut is inflamed, it can cause problems with the immune system, which can actually be a risk factor for allergies. In fact, research studies documented that babies born by C-section have more allergies than babies born vaginally because they lack the initial contact with the important bacteria there. Because my passion is being a medical detective and finding out what is behind people's symptoms, I'm always searching for alternatives. I often recommend high-quality probiotics to help my patients improve their digestive function and in turn help to bring their immune system into a healthier balance, which can often bring the allergies and sensitivities under control. Another way to support the immune system is to make sure you have adequate levels of vitamin D. If a person is low on vitamin D, they can be more prone to allergies and sensitivities. It could also make them more susceptible to infections and getting sick more frequently. The way we find out if we have a healthy level of vitamin D is through blood tests. The acceptable common level is 20 or 30 nanograms per milliliter or higher. But research has found that optimal levels are more in the range of 50 to 80 nanograms per milliliter. I will often check a patient's level to be sure that they have enough. Of course, depending on a person's tolerance, the common way to get vitamin D is from the sun. But everyone has a different tolerance for the amount of sunshine that's safe. So if you're uncertain, please talk to your doctor. There are also high quality medical grade vitamin D supplements that I prescribe for my patients. I trust our discussion has been useful for you. If you or a loved one is suffering from unexplained symptoms, it might be from hidden allergies and sensitivities. The key is understanding the connection between food, the gut, and the immune system. Remember, we offer a no-charge personal health strategy session. That's our phone consultation where you can talk with me personally about any health concerns you may have and about how to feel empowered about your health. To arrange one, just call our office and ask to be scheduled for your free consultation. What we do during the consultation is that I talk with you about your health concerns, and then we come up with a plan to see how I can help you the most. Our phone number is 808 425 2987. You'll find all our contact information right here on our Facebook page. In fact, you can just click on the contact button. Mahalo, and I look forward to being with you in another 2 weeks. Aloha.